Hi, it's Monique from Kids Chatter Speech Pathology. I wanted to talk to you today about lisps. Now, most of you probably know what a lisp is, or might even know someone who actually has a lisp. And I'm talking about one of the most common ones that we see in our clinic. Now, although there are actually 4 different types of lisps that children can have, or even adults, I wanted to talk to you specifically about the interdental lisp. So that's the one where the tongue sticks out between the teeth. So instead of a s sound, it comes out as a th. So things like sock will be thock. So this is the one that we see most commonly in children. And there's a bit of a misconception about the S sound overall. A lot of people tend to assume that the S is actually a teeth sound. So what I wanted to talk to you today is actually that it is more about the tongue positioning and not so much about the teeth. Although the teeth do have a role to play in making a correct S sound, it is very much a tongue sound, and it is the tongue position that is important. Because whether or not you actually have teeth, such as if you think about kids who are growing and obviously they lose their baby teeth and temporarily they have gaps until their adult teeth grow in, we often actually get people thinking, oh, when my child loses their front teeth, that they're suddenly going to lisp. Now, that is not necessarily true. Although children may temporarily sound like as if they have a lisp when they first lose their front teeth. Generally speaking, if they have been able to correctly say their S sound throughout this whole time already as they're developing, then losing their front teeth shouldn't suddenly cause a lisp in terms of a long-term lisp. And I'm going to show you soon actually with my own daughter who has lost her 2 front teeth. So we can actually see what her tongue is doing when she is talking, in particular with the S sound. So I wanted to show you that although she is missing her front teeth, she can still very clearly make a correct S sound. And I wanted to show you what that looks like and what it sounds like. And because she does have that gap, you can actually see that it is all about the tongue and the position that it should be in to make the correct S sound. Now, there are children who do have a lisp, obviously, where the tongue sticks out, and then when they do lose their baby teeth and have a gap, that tongue more than likely will continue to stick out. So yes, those children will still have a lisp because not only are their teeth missing, but their tongue isn't actually making the right tongue position for that correct S sound. So the misconception that the S is a teeth sound is incorrect because of the fact that it should be where the tongue is positioned that makes the correct S sound. So the most important thing to remember to make a correct S sound is that the tongue tip needs to be behind the top teeth. So when they're not behind the top teeth and it's sticking out, that's when you get the interdental lisp that most people are familiar with. So I wanted to show you some examples of my own daughter who will say some simple words starting with S and also a couple of sentences where you can actually see that her tongue, although she has a gap, is still well behind where her teeth would have been if they were grown in. And you can see that despite the gap, she's still able to make the S sound perfectly. Now, because she does have the gap, it sounds not quite as crisp as the S sound that we can make because the teeth do alter the way that the sound does come out. But in terms of the S needing to have the teeth to make it is not necessarily the case because it's where the tongue is positioned, which is behind where the teeth should be, is the most important. So have a look and have a listen to what a correct S should sound like and what it should look like when you are watching what their tongue is doing. So what is your name?
Alyssa.
And how old are you?
6.
Now let's show everybody how we make the S sound, that is the snake sound. Can you show us?
Sure.
Good. Now let's get in nice and close so that we can see what your tongue is doing. Good. So we see that tongue sitting in behind the teeth. Show us again. Nice big smile. Lovely. Now let's do some of your words. Let's start with the S sound. Sock.
Sock.
Sun.
Sun.
Sea.
Sea.
Seesaw.
Seesaw.
Seat.
Seat.
Seal.
Seal.
Good. Let's try a few sentences. I sit on a seesaw.
I sit on a seesaw.
Let's get in nice and close. Let's do Sam is singing a song.
Sam is singing a song.
What about I eat a salad?
I eat a salad.
The sailor is wearing socks.
The sailor is wearing socks.
7 silly seals.
7 silly seals.
Sitting on a seesaw.
Sitting on a seesaw.
Eating salad and soup.
Eating salad and soup.
A seasick sailor.
Seasick sailor.
A sailor is wearing socks.
A sailor is wearing socks.
Sam is singing a song.
Sam is singing a song.
Now, if you have a child that is producing their S's with their tongue between the teeth, so they're using that interdental lisp, then it might be worth seeing your local speech pathologist to get that assessed, to confirm that it is in fact an interdental lisp and not one of the other 3 types that could also potentially be the case, and what might be the underlying reason, the cause for that lisp. Some children develop a lisp and it's just part of the way that they're speaking and they have never learned how to correctly make the S sound, which is what can definitely be done in therapy. Other times it could be that they have an underlying tongue thrust swallow. So because they're continuously thrusting the tongue forward during eating and drinking and any time that they swallow, it is likely that that tongue pattern is also impacting on their speech, resulting in an interdental lisp. Other causes that can often contribute to resulting in an interdental lisp is thumb suckers and prolonged dummy use. And that is because it is encouraging that forward thrusting motion that the tongue does because they're continuously sucking on either a thumb or any of the fingers for that matter, or a dummy. Now, that's not to say that any child that is a thumb sucker or has ever used a dummy that they will have a lisp, but they are more at risk of developing a lisp if they're quite young and they're not stopping that sort of habit. If your child is already much older and obviously talking and they're still thumb sucking or they are using a dummy, we would definitely encourage you to try and reduce that habit to avoid it turning into a speech problem as well. But if you do have any questions or you would like to actually see a speech pathologist to help your child with a lisp, we see loads of children with them in our clinic and have a very high success rate in treating them. So if you have any questions or just want to get some more information, please give us a call, send us a private message, or check out the blog on our website, which is all about the different types of lisps, what to look out for, and more importantly, what you can do about it to get it treated.